So let's take this to the extreme. I'm going to zoom in on this model one more time. So I'll show you the inside of the foot. Can you zoom in for me, my friend? I'm going to hold the tibia bone above the ankle. So the typical foot has an arch from the heel that goes up towards the toes. And we talked about a ligament that kind of suspends that arch and keeps it tight. There are people who are born that have just the opposite condition, where instead of an arch, they have a very flat foot.
Right.
And I think our government very inappropriately kept people out of the Army for flat feet when it was really the opposite, the high arched foot. That was very rigid, that broke metatarsal bones. These are the metatarsal bones when people were forced to march in boot camp. And because a very flat foot is like a duck's foot, it's floppy, it bends into 100 directions, but a rigid, high arched foot, if you see what's called a cavus foot, think of the word cave, that's a very rigid foot. It's very unforgiving.
It is.
And often infinitely more painful, but much more rare. Right. A flat foot is common. A viewer had called in a question and asked us, her son's enrolling in the military, he's got flat feet. Tell us a story about, should he anticipate problems with a flat foot, either while he's in boot camp, while he's deployed, if he's deployed, or throughout his life?
So with flat foot, there are a lot of different treatment options. So first is supporting the arch if you can, if it's to where proper shoe wear goes into it again, proper arch support, as well as there's bracing that can help support it. I would not technically recommend right off the bat if someone has flat foot and they're thinking going to the military, going to have what we call flat foot reconstruction, where it's a major complicated surgery where we basically rebuild the arch and move tendons into different areas to recreate the arch, which is highly complex and would actually likely make it very difficult to go into service because of the heal time and the scar tissue and everything from there. With proper bracing and support and shoe wear, you can have a normal life going to the service or going to your job as any physically demanding job relatively and do well. There are still some patients with the flat foot that can develop arthritic conditions to where, because the joints do not line up as the normal foot, which very few people actually have a normal foot, the joints can have a little increased wear and tear on them that result into more arthritic conditions that have to be treated down the road, and such as with surgical treatment if it got bad enough. But typically with the proper support to offload the stress on the joints and the ligaments and tendons that are involved with a flat foot, you can relatively get by and do very well and be active.
Very rare do we need surgery for that.
That's right.
Right. It's not a life-restricting thing like it was deemed like it used to be.